Psoriasis Arthritis Complete Guide by Nopsor. Up to 1 in 3 people with psoriasis will develop psoriatic arthritis. Most of them won't know it's happening until joint damage has already begun. Not because the symptoms aren't there, but because psoriatic arthritis starts quietly. Morning stiffness you blame on sleeping wrong. A swollen finger you think is from an old injury. Fatigue you chalk up to stress. By the time most patients get a correct diagnosis, they've already seen 2 or 3 doctors who missed it. This video is going to change that for you. In the next 6 minutes, you're going to learn 4 things: what psoriatic arthritis actually is and why psoriasis causes it, the early warning signs that are most commonly missed, including ones that have nothing to do with your joints, why psoriatic arthritis gets misdiagnosed so often, and what you can do about it, and the single most important thing you can tell every doctor you see. Let's start with the most important thing to understand. Psoriasis and psoriatic arthritis are not 2 separate conditions. They are 2 expressions of the same underlying problem, an immune system that is permanently switched into attack mode. In psoriasis, the immune system attacks the skin. It sends out inflammatory proteins called cytokines, including TNF-alpha, IL-17, and IL-23, that tell skin cells to multiply 10 times faster than normal. That's what creates plaques. The problem is, those same cytokines don't stay in your skin. They circulate through your bloodstream, and when they reach your joints, they do the same thing there. They trigger inflammation. They cause swelling, pain, and over time, if left untreated, structural damage to the joint itself. This is why psoriatic arthritis is called a systemic condition. It's not a skin problem that spread to your joints. It's an immune problem that was always systemic. Your skin just showed the signs first. And here's what makes this especially important. Up to 30% of psoriasis patients develop joint involvement, but research suggests many more have early joint inflammation that hasn't become painful yet. Which means if you have psoriasis, your joints deserve attention even if they feel fine right now. Now let's talk about what psoriatic arthritis actually feels like in the early stages, because this is where most patients and most doctors miss it. The first sign is almost never dramatic joint pain. It usually starts with something much more subtle: morning stiffness. Not the kind that goes away in 5 minutes, the kind that lasts 30 minutes or more after you wake up, in your fingers, your lower back, your feet. That duration is significant. Mechanical joint pain from wear and tear usually eases quickly with movement. Inflammatory joint pain from psoriatic arthritis takes much longer to loosen up. That difference matters. The second early sign is dactylitis. This is when an entire finger or toe swells. Not just the joint, but the whole digit. It looks like a sausage finger. It can be mildly uncomfortable or quite painful. Many patients notice it and think they bumped something. Dactylitis is one of the most specific indicators of psoriatic arthritis. It's relatively rare in other forms of arthritis. Third, nail changes. Nail pitting, nail lifting from the bed, discoloration underneath the nail. If you have psoriasis and your nails are involved, your risk of psoriatic arthritis is significantly higher. Nail psoriasis and joint involvement are closely connected. Fourth, enthesitis. This is pain where tendons or ligaments attach to bone. The most common location is the heel, specifically where the Achilles tendon meets the heel bone, or the bottom of the foot where the plantar fascia attaches. If you have unexplained heel pain and you have psoriasis, that connection deserves a conversation with your doctor. And fifth, fatigue. Not normal tiredness. The kind of fatigue that feels disproportionate to your activity level. Systemic inflammation is exhausting. Your immune system is working overtime and your body feels it. Any one of these alone might mean nothing. But if you have psoriasis and you're experiencing 2 or 3 of these, morning stiffness, a swollen digit, nail changes, heel pain, unexplained fatigue, that combination deserves serious attention. Here's why psoriatic arthritis gets missed so often, and why it matters that you understand this before you walk into a doctor's appointment. Psoriatic arthritis is most commonly misdiagnosed as rheumatoid arthritis. The symptoms overlap significantly. Both cause joint swelling, morning stiffness, and fatigue. Both are inflammatory. The difference is in the details and in one critical piece of information. Rheumatoid arthritis typically shows a positive rheumatoid factor in blood tests. Psoriatic arthritis usually does not. So, when a patient with psoriatic arthritis gets a blood test that comes back negative for rheumatoid factor, the doctor sometimes concludes there is no inflammatory arthritis and stops looking. The diagnosis gets delayed by months or years. Psoriatic arthritis also gets confused with gout, fibromyalgia, and general wear and tear, again, because symptoms overlap and because doctors who aren't rheumatologists may not immediately connect skin psoriasis to joint symptoms. This is where you come in. The single most important thing you can do, and this is the detail that changes everything, is to tell every doctor you see about your psoriasis when you discuss joint symptoms. Every single one. Your primary care doctor, the orthopedic doctor you see for your heel, the urgent care doctor you see for a swollen finger, all of them. Because the moment a doctor knows you have psoriasis and you have joint pain, the diagnostic picture shifts entirely. Psoriatic arthritis moves to the top of the differential. The right referral gets made. The right tests get ordered. You cannot assume they will make that connection themselves. You have to make it for them. If you suspect psoriatic arthritis, here is what the diagnostic process looks like so you know what to expect. There is no single blood test that confirms it. Diagnosis involves a combination of physical examination, imaging, blood tests, and, most importantly, your symptom history. Your rheumatologist will examine your joints for swelling, tenderness, and range of motion. They will likely order X-rays or an MRI to look for inflammation or early structural changes. They will run blood tests, not to find a positive marker, but to rule out other conditions. And then they will ask you questions about your symptoms: when they started, where they occur, how long morning stiffness lasts, whether you've had swollen digits, what your family history is. This is where being prepared makes an enormous difference. Before your appointment, write down your symptom history. When did you first notice joint symptoms? Which joints are involved? What makes them better or worse? How long morning stiffness lasts? Any episodes of swollen fingers or toes? Any heel pain? A patient who walks in with a written symptom timeline gets a faster, more accurate diagnosis than a patient who tries to recall everything on the spot. You have more power in this process than you might think. If you've been living with psoriasis and any of what you heard today resonated, the morning stiffness, the swollen digit, the fatigue, please don't dismiss it. Psoriatic arthritis is manageable. Early diagnosis leads to significantly better outcomes. The joint damage it can cause when left untreated is preventable. The first step is the conversation with your doctor. And now you know what to say. If you found this useful, this video is part of a full series on psoriatic arthritis on this channel. The playlist covers the immune connection, the early signs, the diagnostic process, and the most common misdiagnosis mistakes, all linked below. Nopsor is a steroid-free nighttime treatment for psoriasis, formulated with coal tar, salicylic acid, and natural herbs. If you're looking for relief without steroids, learn more at nopsorusa.com. Subscribe if you want to understand your psoriasis better. New videos every week.